All right, about 7:46, he says, question mark. I can't see that without my glasses. So far away. I apologize, 7:40 something. Thank you. Ryan Trimble telling me I'm correct. That's all I need to know. Dr. Charles Harrigan this morning. Good to see you.
Good to see you.
Talking things, all Alzheimer's Awareness Month, one of the things in November. Doing a quick research of this, aside from the disease itself, noting that there's more than 15 million caregivers for this disease. I mean, it just shows the prevalency of what's going on right now.
Oh, sure. The disease affects not just the patient, but the whole family, yeah.
As far as the disease itself, I know most of us associate it with aging. That's where the predominance of it is, but it's really not age-specific when it comes to a diagnosis.
No, in fact, Alzheimer's was called dementia precox or pre-senile dementia, with senile just meaning age-related. So it can happen to folks in their 50s, or they don't have to be 70 or 80. Now, you know, the problem with dementias is Alzheimer's is a very specific kind of dementia. There's other dementias, kind of like all tissues or tissues, but Kleenex is a tissue, but not all tissues are Kleenex. So, you know, there's other dementias of the Alzheimer's type. There's dementias due to metabolic problems like underactive thyroid, vitamin B12 deficiency, certain diseases like tertiary syphilis, or latent syphilis, I should say. You can have dementias due to water on the brain, what we call neural pressure hydrocephalus. So when a doctor sees a patient with a memory problem, they first of all see, are they demented, and then work them up and see, is it a structural thing, is it metabolic? And at the end of the day, Alzheimer's is kind of a diagnosis of exclusion. And the real issue in making the diagnosis is a lot of patients early in the disease, they're either not aware that they have a memory problem, or they're embarrassed, and so the ones around them notice, you know, like mom or dad, something's wrong, or, you know, they're not acting like they should. When they go to the doctor, you know, you talk to the patient, sometimes it's hard, because like in diabetes, it's easy to check a sugar and slice and dice their blood pressure, but with memory, it's kind of a slippery thing. So often we'll refer people to neuropsychologists, that they do a bunch of testing and go through tasks and standardized questions to kind of see. And then later in the disease, you know, the patient accepts they have a problem, and then the problem is further in the disease, they often lose any insight into there's a problem. You know, so it's a disease that, you know, it affects the patient and the family, the caregivers. It's a big toll.
And one of the interesting things that you mentioned that caught me right away is an individual may not even know they're going through this.
Right.
Is that one of the heartbreaking things that you see with this illness?
Oh, yeah. And, you know, especially if they really don't believe they have it, we go through a bunch of testing, and then we follow them serially, and often, like the neuropsychologist, will bring them back in 6 months and retest them. You know, eventually they'll see, they kind of call it mild cognitive impairment, and then it kind of progresses to a dementia. And, you know, the drugs we have to intervene, you know, if you recognize and start it earlier, they may retard progression.
But no cure for this.
No. And, you know, the Alzheimer's specifically, what it is, it's a disease where a protein called beta amyloid gets kind of stuck in the cells in the brain, and it kind of clogs things up, so to speak. You get these things called neurofibrillary tangles, that it's really a physical thing in the brain. And the only way to know for sure is to do a brain biopsy. Nobody's going to do that. Like, you know, if you do an autopsy series, you'll see the stuff in people's brains. And they've done studies on drugs to help prevent beta amyloid from forming, and it didn't pan out. You know, so the drugs we have drugs, they're called cholinesterase inhibitors. You may have heard of drugs like Aricept, Exelon, Cognex. They raise a chemical called acetylcholine in the brain. That's like when your mom and your kids said, eat fish, it's brain food. You know, that's lecithin that eventually becomes acetylcholine. And these drugs raise the levels of acetylcholine in the brain. And then we have another class of drug called Namenda. And these are the only two kinds of classes of drugs we have. So, you know, the earlier you start, probably the slower the disease may progress.
All right, and obviously it's a disease that if you have the questions that you feel that maybe a loved one or even yourself may need to speak to a physician, don't email me, don't call me. Always go to the source, go to the doctor himself. Doc, I appreciate the time.
Hey, thanks. Appreciate it.